Hi there, my name is Sarah and I am a student in the UCAN program. I completed my clinical rotations for nursing care of childbearing families on May 29th, June 4th, and June 5th. I enjoyed them very much. I'm talking today about some strengths and weaknesses that I identified during and following the assignment. I'll start with my weaknesses. First, I think that my nursing skills are not the speediest, although I hope this will come with time. Preparing medications and injections and preparing for any kind of assessment, I'd like to be a little quicker. I also think that I can work on prioritizing my tasks and interventions. While being in an accelerated program has really improved my time management with school and studying functions, I'm still working on it from the perspective of a nurse rather than a student. So I'll definitely prioritize tasks and interventions, and that also ties into the nursing skill speed, just making my care of patients more efficient. Lastly, I want to continue working on interpreting the fetal monitoring strips, particularly in the sense of what category they belong to. I also noted this on my exam wrapper. The categories 1, 2, and 3, I want to review the requirements for each category and make sure I'm putting everything in the correct category. Lastly, I am going to talk about my strengths during the clinicals. The first day I was on mom-baby. The second day I was in admit, so right after the babies were born, and we were admitting them as a patient and doing their newborn assessment. And then the final day I was on labor and delivery, where I was able to see a vaginal delivery as well as a tubal ligation and surgery. One strength that was noted by my preceptor, and I'd also like to point out, is being proactive and obtaining learning experiences. I think that I'd like to continue this, of course, even as a nurse as well, to always be looking for learning experiences. For example, there's no C-sections being performed on the day that I was assigned to labor and delivery, but I did note that there was a tubal ligation being performed, so I asked if I could observe that as well, just to be present in the operating room and talk to the patient, the CRNA and the resident and the nurses about what was going on there, as well as jumping into any rooms that needed help or asking questions with nurses, to be proactive and always learning something new, always seeing something, and trying to apply what we had learned in class. My second strength came the second day when I was working with one of the nurses in admit, and that was repeating skills over and over again in the proper way to form good habits. So I got to perform 5 newborn assessments. The first one, I worked with my nurse and observed her, and then and performed it after her, and then as the day went on, I was able to do them by myself. Just getting in the habit of always doing things in the same order, so you never miss anything, or if you miss something. Always just not skipping anything and going through systematically really helps you build good habits. I also was able to do the hepatitis as well as the vitamin K injections, and learn to do those before you do vitals, before you piss baby off and inject them, get their vitals ahead of time and listen to their hearts and lungs ahead of time. So it was nice to be able to gain that experience as well. I really enjoyed these rotations, and I look forward to learning more in class. Thanks very much.